By Saturday night, he started in with a lot of pain about 10 o'clock at night on this side of his heart, and it wasn't on the side of the heart. And so I give him one of the potent pain pills, and didn't take the pain away. By 2 in the morning, I had to give him another one. I put him on the machine, and the minute his pulse went in, they called right back when we'd got through with it, and they said, call an ambulance, get an emergency.
Great Lakes Home Health and Hospice, watching over you.
Welcome to Healthcare in Your Home, featuring Dr. Patel. Brought to you by Great Lakes Home Health and Hospice, where superior quality care is our passion.
Great Lakes Home Health and Hospice, watching over you.
What is a HomeMed telehealth monitor?
Telehealth monitors from HomeMed consist of a number of different pieces of equipment. First, there are pieces of equipment that will measure weight or ECG, blood pressure, temperature, a whole series of different vital signs. Those peripherals are connected to what amounts to a small computer in the patient's home. All of that data is then sent directly to our office via the patient's telephone line. In the office, the information is reviewed by our nurse, and then we can make decisions about the care that's provided for those patients based on the things that we see going on with the patient in their home.
How does a HomeMed telehealth monitor help?
Once the patients are being discharged or seen in the office and followed up, between the next follow-up, if we have some data on the patients, how well they are doing. So it helps to evaluate their progress. That's the one thing. It also helps to see how good the compliance of a patient is during that time frame before the next visit.
Our primary goal is providing superior quality care. Using HomeMed telehealth monitors, we can get empirical data on the patient every single day. We can know what they're doing, how well they're doing, and that data helps us to improve the quality of care and in some instances change the plan of care based on the patient's condition.
What does it monitor?
Usually what we get is the patient's weight, patients, the telemetry monitoring, what the rhythm is like. And usually they are sent once a week or maybe twice a week. Depends on the situation. Every patient is different, and those informations are sent over, and then we review them. And based on the finding, we made the readjustment on the patient's care, and overall it improves the quality of patient care, prevents further admissions to the hospital. And before patient gets in real trouble, we are basically taking care of them.
What happens if the data shows that there is an emergency?
I said, are they going to send a nurse out? And they said, yes. Well, within minutes, a nurse was here. And the nurse called the ambulance because I was pretty well shook up.
If our nurse discovers that there's something that she has concern with, she'll call the patient, sometimes ask the patient to remonitor, and if the data is confirmed, the nurse will then call the patient's physician and talk with the patient's physician about the things that they're seeing, making decisions to send a nurse or to send the patient to the doctor, or in some instances actually send the patient right to the hospital.
Who should use a HomeMed telehealth monitor?
It is recommended for the patients who are discharged from the hospital. People who have congestive heart failure, we have been following them as an outpatient. And patient who has disease who is kind of semi-active. Before they get in trouble, we want to catch those troubles and try to take care of them.
If we hadn't had that, I don't know what. The machine saved his life. And it was very comforting to know that I could talk to somebody, because I didn't know. I didn't even check his pulse.
Great Lakes Home Health and Hospice, watching over you.